Thank you. I'm sure we all vividly remember that day last year when COVID-19 was introduced into our community. I was not the mayor of the city of Regina at that time, but like everyone else, you were probably glued to those global pandemic numbers and incredibly uneasy about what this would all mean. So March 13th, 2019, the date of COVID became a part of our lives, and ever since that day, like many of you, it's been a foremost priority. With this said, like many of you, I yearn for better days, moments with family and friends, backyard barbecues, summer concerts, rider games. But to return to those moments, we cannot let our guard down today. And for at least the next 4 weeks in this battle that we're in with COVID-19. As a community, we are facing an unprecedented time with cases of the COVID variant rising in our community. We have to take an immediate stand. We have to be better. I'm saddened and disturbed by what I'm reading and hearing from our public health officials about COVID cases in our city. 101 new cases today. We have 65% of new cases in the province are here in the city of Regina. 75 to 90% of those new cases in the last week are testing positive for the UK variant. So there's so far 67 cases the UK variant as of yesterday have been detected in the city of Regina. What does that mean? It means that the variant of concern, which is how they refer to it, the virus is spreading more quickly. It transmits at an exponential rate. To put this into perspective, at 2 meters of social distancing after 15 minutes, you are considered to be in close contact with someone if they're COVID positive. In that same situation of 2 meters of social distancing, it takes 1 to 2 minutes to be considered a close contact with someone with the variant. Transmissibility means an increase in hospitalizations, and what we know is that an increase in hospitalization will invariably mean an increase in deaths. Many of our outbreaks are a result of people going to work, going into public places, household gatherings, while symptomatic. I am asking every member of our community for help. This has always been a team approach, a community approach, and one founded in the greatest respect for our neighbors and those of our most vulnerable residents. So what to do? Wear a mask. Wear a mask when you're at work. Wear a mask when you are carpooling to work. Wear a mask when you're in the presence of individuals outside of your household bubble. Wash your hands and sanitize often. If you will be in contact with someone who is 50 years of age or older, do not participate in gatherings outside of your immediate household. Regardless of what has been announced, stick to your household, your immediate family, your household bubble. Work from home if you can. Do not travel if not necessary. With the incidence of the variant in the city of Regina, traveling outside of the city of Regina potentially puts other communities at risk. Be careful about going out and shopping. Practice social distancing. Stay home if you're not feeling well. This has been consistent messaging for the past year. We can't let up now because it's nice outside and it felt like those numbers were coming down. This is the check for us all. Minimize your exposure settings. Most importantly, get vaccinated. Take the first one offered. I was able to speak to our city's deputy medical health officer this morning, and he was emphatic that vaccines are extremely effective at preventing hospitalizations, reducing the incidence of disease and death. And they're very effective against the UK strain that is present in our community. The drive-through testing opened up on Sunday. We were able to process, I believe, 1,200 additional healthcare workers. All of the residents of our long-term care homes have been offered, and most have taken the vaccination. Why that's important is that there have been cases of individuals that have been vaccinated who have then tested positive for COVID, and it's a mild case of the flu at this point in time. The best source of information and up-to-date data for booking your vaccination, which are open to 70 years and older right now, is on saw 1,700 people go through it in one day. Originally, the wait times were excessive. Once it started running smoothly, they did not really exceed 3 hours, and by late in the afternoon, they were down to an hour or two. There are porta potties available. The Exhibition Association has opened up the bathrooms in the Canada Centre. We'll make it as comfortable as we can for you. They also were able, by appointment of 70 years or older, to immunize 309 people yesterday. This is the way we're going to tackle it. We need everyone to continue to practice social distancing and reduce your contact. Don't be the neighbor, the coworker, or the classmate that comes into contact with someone who was vulnerable to this disease. Take the steps necessary to keep our city safe and be very careful for the next little while. I'm open for questions.
Are you ready for questions?
Absolutely.
I just recommend that the public take extra precautions. Like, is there anything that the city of Regina has jurisdiction to be doing? I think a lot of us were thinking maybe you even called for a lockdown of the city today.
I have met with the province. I've spoken with the chief medical officer, the public health officer for the city of Regina, and these were his recommendations in terms of offering up messaging that was specific to the city, in terms of there's some confusion out there as it relates to what we're supposed to be doing. With the nice weather, if you were out and about this weekend, you would have seen that our parks were packed and that social distancing is not being followed. There is an effort not to pick on any one particular community or demographic would be the way to say it, in terms of where the spread is happening. But the notion is, again, if you're going to come into contact with someone who is 50 or older, do not participate in public gatherings. Don't go to parties. Don't go to people into household gatherings outside of your immediate household. The province has an announcement coming up at 3 o'clock. We're looking to Dr. Shahab in terms of some of the things that they'll be doing. They did reach out on Friday to the city of Regina and put us on standby notice as it relates to the variant. They're looking at this on a pretty much every 8 hours. They're looking at the numbers that are coming in and what's reporting in the testing, and we're essentially on notice.
Does the city have jurisdiction to put a lockdown?
We have jurisdiction over some things. We don't have jurisdiction over others. For example, if schools are going to shut down, that is not up to the city to tell them to do that. Council and myself will be discussing this tomorrow, again, post the provincial announcement at 3 o'clock.
Would you like to see the province put a lockdown and if that comes to the Regina?
I think the concern is that without available data about where transmissions are happening, which isn't entirely fair because we are aware of where transmissions are happening, which is part of the reason for the messaging, is that there's no data to support people going to restaurants aren't contracting the virus at the restaurants. That's not the way this is working. They're capturing it at work. People are going to public gatherings, they're going to household gatherings, and then they're walking away, and then they're spreading it that way. And so it's that restriction that we're looking for.
Do you think this is kind of tough though, because now we can have 10 people in our households, and as much as these are recommendations, as you said, parks are packed this weekend. I know people who are having 10 people in their house. These are all just recommendations, and as we've learned from the past year, people aren't going to follow the recommendations. 101 cases today, 156 in the province. Isn't this saying we need to be doing something more?
By the same token, if you perform a lockdown, the people who aren't following it today still won't be following it.
Can you verify, just about that standby comment, that the city is on standby and the government is just taking a really close look at these numbers and the VOCs in the city. So maybe if you can clarify that for some people, because they may be trying to figure out about that.
So the provincial government, through the chief medical officer, through to the deputy medical officer, reached out and let us know that the variants were of concern as of Thursday and Friday, and that we would be on notice in terms of what further measures they would be taking depending upon the numbers coming back. The truth of the matter is that the AstraZeneca vaccine that was rerouted to us, so we would receive the 15,500 that are available. vaccinating people is actually the number one way to combat the variant. That's the number one way. And so the idea that it opened from 60 to 64, and I suspect that it's going to open because 65 to 70 is sort of left in the wind right now. But the province shifted and are going to attack a lot of the increase with vaccinations. And in other jurisdictions, that's how they found the most significant reduction in transmission has been through vaccination.
So you said with being on notice that there's further restrictions that could come in, or further measures, what kind of further measures, what kind of further restrictions, and it just being done?
I think this is one of only two cases. I think they addressed the North in a specific way, and this will be the third time, and another time they addressed PA, Saskatoon, and Regina separately. I think they're looking at a regional approach as it relates to Regina specifically, and anything is on the table.
Is there any kind of reticence to try and do something here now? I know that when COVID-19 first kind of came to the province and we saw it in the city, there's an attempt by City Council to kind of get out ahead of what the province was doing, and that was shut down. It was started on a Friday, and then on the Monday it was rolled back. Are you reticent to do anything additional? Are you reticent to do anything outside of what the province is recommending because you think it will just be rolled back?
I think it comes down to jurisdictional authority and enforcement. Without provincial authority, specifically through the Saskatchewan Health Agency, which is who the emergency order comes from, is the SHA. Without that authority and without that sort of ability to enforce, anything we do is, again, it's to your point, their recommendations at that point in time.
In your discussions with the province, was a targeted lockdown part of that discussion?
Yes.
Can you expand on maybe what types and any types of circumstances would be involved and what that might entail?
I think that given that we've already gone through one lockdown, I think the notion is that understanding where the transmissions are occurring is going to be part of the measures that would be undertaken. And again, if they're not happening in restaurants and shutting all of that down doesn't make any sense. Is limiting time for businesses to be open? Maybe. Is schooling an option? Maybe. But again, it's about who's bringing a positive result into, frankly, the workforce. And so the work from home option, you'll notice that I think we're at 17% here at the city. If everybody continues to stay home, and as they gear up these vaccinations into the end of March and mid-April, we should have everyone over 70 mostly done, everyone over the age of 60 mostly done, and that's going to reduce the vulnerable population to a significant degree.
What percentage of the city is working from home right now? The city employees?
You know, I actually don't have that number. I do know that we're at the City of Regina at 17%, so we have 83% of our workforce working remotely. I do know that there's similar modeling happening at most of the Crown corporations. FCC would be another example where I believe, 20%. And even those who are coming back into work, they're doing shift changes. So if you're in Monday, Wednesday, Friday, you're not in Tuesday, Thursday. And mask wearing is at all places of business when you're not sitting at your desk alone in a room.
Are you hoping to see the province institute a target?
I don't think hope is the right word. I think the city is open to any and all possibilities as a result of kind of what happens over day to day. Frankly, it's being monitored day to day.
So given that you're speaking about attendance, is there anything that you hope comes out of that conference that the province should have today?
I think attention will be continued to be paid to Regina, and frankly, we're appreciative of that. We're appreciative of that redirection of vaccines, which were supposed to go across the province and have been targeted here in an effort to get the variant under control. And frankly, to protect the people that are most at risk of serious health complications from COVID. That's the intention, which again, we go back to, if you're 50 or over, limit who you're in contact with.
Because the city also has a chief medical health officer, I don't know if that's like, what's this officer? I guess why lean on the province so much for advice? What's the city's health officer saying?
So our health officer, Dr. Hennig, is a deputy chief medical officer. He reports into the chief medical officer, just as they all do. Ultimately, jurisdiction and authority lies with the Saskatchewan Health Authority. So he is in twice a day, if not more, conversations with Dr. Shahab. And when I spoke with him and I asked about, efforts that could be undertaken at the city, he said, get the messaging out there to, regardless of anything, take control of yourself, limit your household bubble, and wear a mask, and just significantly reduce your chance of exposure.
I can change topics slightly for a moment. The Semple family are now the sole owners of the Regina Pass. They've reopened the idea of building a new hockey rink that could be used for concerts, other major events. Do you think that the city of Regina should build a new hockey arena that can be used for that and a variety of other events?
What I can tell you is that the Brandt Centre probably has 5 to 7 years left of its usable life, and a decision will need to be made about whether to refurbish that or to go in a different direction. If there was an interest in someone privately building an arena, we would be completely open to that. But a decision is going to need to be made in the next 5 to 7 years as it relates to the Brandt Centre and that sort of space.
Has the city been involved in any discussions about building a new arena that the city would be involved with?
No, outside of the Exhibition Association basically reporting into us the report on the Brandt Centre itself, I think over the next year, the review of all major infrastructure, sort of those top 10, as we know they're going to be reaching end of life, there's going to need to be some prioritization of some of those projects.
Any more questions for the mayor?
Thank you, Mayor.
Thanks, guys.